Hello everyone, I'm Jonathan Kaplan, founder and CEO of BuildMyBod Health, a price transparency platform, and I'm also a board certified plastic surgeon. I wanted to talk to you about the recent price transparency rules that came through from President Trump and the Trump administration in regards to price transparency and how it's going to affect all of us. So if you remember back in June, they released a proposal for price transparency as far as the hospitals listing their negotiated rates. In the past, the hospitals listed their charge master rates, which really are just the rates that they bill to the insurance company. That's like these really inflated rates that nobody actually ever pays, so it doesn't really provide any actionable information to the consumer as far as shopping around for healthcare. So in June they said, you know what, instead of just the charge master rates, we're going to require the hospitals to release their negotiated rates. And the rule came down just the other day where it's official now. Starting in 2021, the hospitals are going to have to list their negotiated rates in addition to the charge master rates and some other discounted rates and the cash rates and everything, just to give the consumer as much information as possible. But the thing that was kind of interesting and quite surprising about the rule is that they went deeper. They said, you know, you have to have shoppable services. You have to list 300 procedures like, you know, delivery, vaginal delivery, C-section, colonoscopy. They listed specifically 70 shoppable services, and they said the hospital had to come up with another 230 that they needed to publish as far as negotiated rates on those shoppable services. But the other thing that they also proposed at the time, now this wasn't part of that rule, but the other thing that they proposed was also to have the insurers who deal with employees who have health insurance through their employees that have health insurance through their employer, that they're going to have the insurance companies list the negotiated rates that they have with those employers and all the different contracts they have with the doctors and facilities that those employees can look for. So that was really one of the more surprising things about the announcement the other day. It wasn't just the rule that implementing the negotiated rates by the hospitals in 2021, but also the proposal that the insurers also list their negotiated rates. So the administration is really trying to improve price transparency in healthcare from two angles: requiring the hospitals to list negotiated rates, and also potentially the insurers listing negotiated rates that they have for employer health plans. So it was really a great day for price transparency in healthcare. If you have any questions, just comment below. And if you have any questions about BuildMyBod Health and what we do, we provide price transparency, and we embed price estimators into doctors and facilities websites so the consumer can check pricing either at the bundled rate or the cash rate or the negotiated rate that is payer specific. So we can provide all those services for the doctor's website, for the facility's website, so that you can then capture leads from those consumers that are checking pricing. So that's what we do. Please feel free to ask us other questions.